We begin with developing news. A 10-year-old girl from Cumberland has died from a staph infection associated with Enterovirus D68. It's a story we've been tracking since the Department of Health made that announcement this morning.
Health officials say this is a very rare combination, and they're still not sure what role the virus played in the little girl's death.
We have in-depth coverage for you tonight. Eyewitness News reporter Jared Pliner is standing by with information on what parents should do to keep their kids safe.
But first, let's go to Susan Campbell live outside the Department of Health headquarters in Providence.
The little girl's name is not being released, but we know she was in 5th grade, and health officials tell us she didn't have any underlying health problems. For a healthy 10-year-old from Cumberland, sickness came on quickly and furiously.
She got a little short of breath. Her parents didn't think much about it, took her to the hospital, and really by the time she got to the hospital, everything fell apart.
Within 24 hours, the little girl had died. Tests confirmed the 5th grader had a serious staph infection called Staphylococcus aureus sepsis and also Enterovirus D68, a respiratory illness that's sweeping the country.
It's not clear, what role the enterovirus had, but clearly the death was a sepsis death. This is something that happens rarely, but it happens. It's a tragedy when it happens. It's a perfect storm.
According to the Centers for Disease Control, 3 other people who've had Enterovirus D68 have died. Health officials say the role the virus played in those deaths is unclear. Dr. Fine reminded us today that there is no vaccine to prevent enterovirus, and there's also no medication to treat it. Mike and Shannon.
Susan, do health officials have any idea if enterovirus may have weakened the girl's immune system?
We asked that question during a news conference today, and we were told we'll probably never know which illness came first, and we won't also know if it played any role in the little girl's death at all. For now, live with the Providence Mobile Newsroom, Susan Campbell, Eyewitness News.
All right, thank you very much, Susan. We have in-depth coverage for you tonight. The tragic death of a 10-year-old girl is sending shockwaves across the country and concerning parents who are worried for the safety of their children.
We talked to the Department of Health about what parents can do to keep their kids safe. Eyewitness News reporter Jared Pliner joins us now live with that important information with the Mobile Newsroom.
Mike, Shannon, good evening. What's important to note is that many Americans are apt to contract enterovirus. Hundreds already have, and by and large, it will happen or it will manifest itself as something that millions of us experience routinely every year.
The Ocean State's top public health official noted Wednesday how the merging of enterovirus with an aggressive staph infection, as in the death of a 10-year-old Cumberland girl, is a remote event. Even so, Eyewitness News wanted expert advice on things to keep in mind. First, infants, children, and teens are at greatest risk. For most, enterovirus is nothing more than a cold. Just like the common cold, there's no vaccine or treatment.
We are all at risk for enterovirus, every single one of us.
Enterovirus can progress to wheezing and respiratory problems. Good hygiene and staying away from those who are sick are both paramount.
The take-home message, if there is one, is, make sure your kids are washing their hands 5 or 6 times a day. Make sure that anybody with asthma has their asthma under good control. One of the things that's hard for folks who don't do this for a living to understand sometimes is that we live in a world in which there are lots of viruses and lots of bacteria.
And to expand upon good hygiene for a moment, try to impress upon your kids the importance of not touching their eyes and mouths and noses with unwashed hands. Also, keeping household surfaces clean and sanitized, and for asthma sufferers, staying on top of medications. Live with the Mobile Newsroom tonight, I'm Jared Pliner, Eyewitness News.
The Cumberland School superintendent says the school department is taking extra precautions. Each classroom and all school buildings are being cleaned.
Philip Thornton also emailed parents today to explain why they were initially told that the student who died did not have enterovirus. He says the Department of Health told him last Monday that her death was not a result of Enterovirus D68. So Thornton shared that information with parents the next day.
Today, health officials announced that the student who died had a staph infection and EVD68. Superintendent asked them why he was misinformed. He says they told him the case didn't present as enterovirus.
The Department of Health tells us it hadn't received the test results last Monday and could not have made a definitive statement at that time. Our coverage continues on the air and online. Go to WPRI.com for all the information you need to know about Enterovirus D68.
There we have all the recommendations from the Department of Health on prevention, symptoms, and treatment.